Thank you. Well, today we have Luis Guerra, who is a veterinarian with a master's degree in wildlife conservation and management. And since 2017, he has been working at Wildlife Conservation Society Mesoamerica as the coordinator of the WCS Health Program in Guatemala. He develops research on disease ecology and its relationship with conservation within protected areas with a focus on One Health. And Gabriela Ponce is a biologist who is our other speaker today, and she earned her master's degree in environmental biology. And since 2007, she has been working with the WCS Guatemala Program and the Biosphere Reserve Conservation Programs. And she is the Guatemala Program Country Director, coordinating targeted conservation and management strategies in the Maya Biosphere Reserve and the Pacific coast of Guatemala. Thank you both for speaking with us today about your One Health work in Guatemala. We are very excited to have you, and you can begin whenever you're ready.
Thank you very much, Catherine and Alisa, and thank you all for being here. We feel very happy to join this conversation on call. And Luis, please share your screen. We will start with a general overview of our program in Guatemala, and we will take you to the Selva Maya region where we work. Let us know if you are looking to the presentation now. See? Okay. So our presentation is about implementation of the One Health approach to wildlife conservation in the Maya Biosphere Reserve. Next, as I mentioned, our program in Guatemala works in the Selva Maya region. That is the patch of forest that is shared by the north of Guatemala, the southeast Mexico, and Belize, and is one of the 5 great forests of Mesoamerica. The other one is Mosquitia, shared by Honduras and Nicaragua, Indio Maíz Tortuguero, shared by Nicaragua and Costa Rica, La Amistad, that is shared by Costa Rica and Panama, and the Darien region shared between Panama and Colombia. The Selva Maya has approximately 9.1 million hectares. Next, and thank you. As I mentioned, we share this patch of forest with Mexico and Belize, and it is not only important for biodiversity, but it is also very important for cultural heritage. And all the landscape has hundreds of Mayan cities. And in Guatemala, in the Maya Biosphere Reserve, we have one World Heritage Site, the Tikal National Park. We had many other important Mayan cities, and it is a very important aspect of this place that we are not only working for biodiversity conservation, but also for cultural conservation. And the Mayan cities are an important attraction for tourism. That it's also an addition for the visitation of the areas. Next. The reserve is also important for landscape species that are the ones that need a lot of habitat to survive. For example, scarlet macaws, jaguars, bear tapirs, Central American river turtle, morelet crocodiles, and different migratory birds from the north and the south. And because we share this forest cover with Belize and Mexico, these species can survive in this landscape. We in the Maya Biosphere Reserve have 20% of the Guatemalan amphibian species, 71% of the bird species of Guatemala as a country, 65% of the mammal species. This is a very important area for Guatemala conservation and for the region conservation. Next. As you may know, the reserve is divided in different zones. In this case, 3 main areas. One is the core zone that is composed by the national parks where strict conservation is taking place. Only tourism activities and research are allowed in this area. We have a Parque Nacional Sierra de Lacandon that you can see in the west, and it has frontier with Mexico. Parque Nacional Laguna del Tigre, the bigger one, where we have one Ramsar wetland there. Parque Nacional Mirador Río Azul in the north, that we have frontier with Mexico. Parque Nacional Tikal, that is very famous, and I already told you about it, and Parque Nacional Yaxanacún Naranjo, and one biotope. These areas are the core areas of the Maya Biosphere Reserve, and we have this buffer zone that is a 15-kilometer strip in the south of the reserve, where different activities, cattle ranching, and agro systems are established, also different communities there. It was established as a buffer area for the reserve, and we have the heart of the reserve, that is the multiple use zone, is the area, brown area that you can see, where sustainable management can be done, and all the polygons that you see are forest concessions. We have 12 community forest concessions and 2 industrial forest concessions. These areas can conduct logging activities certified by the FSC and non-timber forest product extraction. Some forest communities have communities living inside, such as Carmelita and Huachatún, and others don't have communities living inside the areas. We are talking about 2.1 million hectares of the reserve and a population of approximately 200,000 people living in there. Approximately 192 communities with an average of 500 people. Next. We have different threats in the area. The change of forest cover by deforestation is an important threat for the reserve. We lost 7,400 hectares per year on average. Next. Forest fires are also an important threat for the reserve, and the change of cover forest by different activities like cattle ranching, and the expansion of these activities in different areas of the reserve, not only in the south but from the west also, is a very important threat for the reserve. Next, as I mentioned, forest fires are also an important threat. You can see that map where each square represents a portion of the reserve with hotspots, and in this part of the world, the forest fires are provoked by humans, are not natural, and it's a very common activity to clear the forest and start with other activities like cattle ranching or plantations, or only establishment of people and new settlements. Next. Also, timber trafficking is a very important threat in the area. As you saw in the maps, we have a lot of area that we share with frontier with Mexico and Belize, and it's very difficult for the authorities to keep controlling some areas. So wildlife trafficking, timber trafficking is a very important threat in some specific areas of the reserve, and also the trafficking of different items, illegal items that are also connected with these activities of timber trafficking. Next. It is a complex and evolving landscape where are different actors that are influencing changes in land cover for different activities. There you can see a piece of land in Laguna del Tigre National Park and an airstrip line where planes are landing with illegal items like drugs. And you can also have here a trafficking of cultural pieces and Mayan pieces. And usually the forest is clear to establish cattle ranches that are used for illegal activities. Next, it is a very complex situation that not only has to do with conservation threats, but as a country, we have problems in governance in some of the areas because of the frontier. These are some publications in the national press about this problem in the Maya Biosphere Reserve, and it implies coordination with different institutions and actors in Guatemala to recover governance in some areas of the reserve. Next. I just wanted to briefly explain how our Guatemala program works. We have different areas where we work. We work with biological monitoring and research, where we work with the GIS group to obtain the forest cover indicators and forest fires to see what we need to do to improve the management of the reserve and give the information to the National Park Service to act in the landscape. We have species conservation work with the scarlet macaws and jaguars and Central American river turtles and with migratory birds. We have a community-based conservation area where we work with the communities for forest fires prevention actions, conservation agreements, and we have 2 long-term conservation programs in Huachactún community and Paso Caballos community, where Luis is going to mention what are we going to do with One Health project. And we include different aspects in these conservation programs in the communities that can improve the benefits of the community, such as education programs, family health programs, and promoting sustainable livelihoods for these communities that live in the Maya Biosphere Reserve. We have also one aspect supporting the government for the environmental protections, governability, and counter wildlife trafficking. We support the national institutions to conduct patrolling in the reserve and to conduct overflights to detect early detection of threats. And we work strengthening the national organizations for control and vigilance activities in the community. We have a new area that we are starting to work about restoration with some pilot projects in the reserve and some technical studies, and including the local organizations in these pilot projects to recover areas that have been under cattle ranching, illegal cattle ranching. And now we will focus next, Luis, in the One Health area that we are working. We work with cattle ranchers that are legally established in the reserve to reduce their impact in the landscape. Some research that we are conducting since several years, and mostly strengthening the capacities of local authorities and actors to implement the One Health approach. I just wanted to mention briefly that we have a marine program in the south coast of Guatemala, and in the bottom of every work that we are doing, we are looking for improving the financial capacity for the conservation of the Maya Biosphere Reserve in the long term. Luis?
Talk about our One Health program here in Guatemala and what are we doing now and what are our goals for this year. So I hope that you can enjoy our presentation. And just like a brief introduction, we all know that concept of One Health approach, that it links the human health, animal health, and ecosystem health. But here in Guatemala and WCS, the health program, we think that it has to be wider and involves a lot of things, that not just the three healths. And we think that it has to be one circle, and that involves all these factors, like driving factors, socioeconomic, political, evolutionary, environmental. The approach has to be collaborative, dynamic, and transdisciplinary. The scale has to be local, national, regional, and global. And at level of individuals, we have to the attributes and behaviors of the individuals. And that's the way that we can have One Health and health for all. And this matches perfectly with the Sustainable Development Goals of the UN, that it looks for the well-being of the people and ecosystems and animals. And finally, we can have we have now a definition of One Health. This is from December 2021. And finally, FAO, OIE, and Organización Mundial de la Salud define One Health as an integrated, unifying approach that aims to sustainability, balance, and optimize the health of people, animals, and ecosystems. And it recognizes that health of humans, domestic and wild animals, plants, and wider environment, including ecosystems, are closely linked and interdependent. So when we work with conservation and with conservation medicine and with communities and protection of the ecosystems, we are working with One Health. So One Health use all the things and put it together to look for the health for all. So we know that we share pathogens with animals, and most of the pathogens come from domestic animals. And we have like a lot of places with a risk of zoonotic disease occurrence. And you can see that the most populated cities are with higher risks. And Mesoamerica in the tropics has a high risk of occurrence of diseases, because we can match all the items that can occur in a pandemic disease. So we have a pathogen flux at the wildlife, livestock, and human interface. And in the biosphere, in the Mayan Biosphere Reserve, we have all these factors: peridomestic wildlife, livestock, humans in domestic landscape, and with the reserve. So we know that the wildlife and the human activity can affect negatively humans and animals. So we have to coexist with this and work with the people to teach them how they can coexist and learn to prevent diseases in their livestock, and they will prevent diseases in for their health and their wildlife health. We have like a lot of threats that Gabi said, and this is the change of the 5 big forests of Mesoamerica, how they change in 15 years. Now we have more relation with the wildlife, and that means that we have more relation with the wildlife pathogens. And it will be a threat if we can prevent this, and we can build capacities in governments and with the people in the reserve. So our the America 5 great forests are important areas for biodiversity, but the emerging zoonotic infection disease risk is more likely in forest tropical regions like Mesoamerica, and we are a region that experiences a lot of land use changes, where we have a lot of biodiversity, and it will be a major threat for human and animal and plant biodiversity for the existence in these areas. So the One Health 5 core approaches of WCS is we are going to focus on the wildlife health, the emerging zoonoses, mitigate the livestock disease, building, we want to build veterinary capacity, and catalyze the global change. And that's our goals for 2030, to work with this and around the world in all of country programs. So we work with a lot of different topics in the Mayan Biosphere Reserve. We work with monitoring biodiversity. We monitor the health of the scarlet macaws, and we conduct some small investigations. As I said, we work with biodiversity monitoring. We work with looking for the populations of jaguar, but it has to be not just jaguars. We have to work with a lot of prey of jaguars and other animals that can coexist with the jaguars. So this can help us to know how is the ecosystem and if there are changes that can affect the health of the wildlife or domestic animals or humans. We work with the reproductive success of the scarlet macaw. We work since 2002 with the monitoring of nests in the reserve, and we start to help the chicks that has problems. And when we start to use medicine and to use our lab in the jungle to help the chicks that are sick or they are not just sick, just we sometimes we took the third chick and put it in foster nest. So we start to manipulate the chicks and put it in foster nest, and we start to have more chicks in the reproductive season. And we conduct some investigations with the health assessment of free-ranging cetacean breeders in Guatemala and Belize. We check for the normal diseases that you can look for in domestic cetaceans, and all the animals were free of diseases. And we work with the Jaguares Forever program, that we work with the ranchers in the buffer zone. We want to promote sustainable ranching, and where they can have a money income, and they can conserve the forest in the ranches. So we want to work with cattle in the right places, the coexistence between domestic animals, wildlife, and humans. We want to put that, we say here the green cow, but it's like the ranches has to be sustainable and use the management of our techniques that are friendly with the environment. We want to prevent and reduce the transmission of diseases. And we signed commitments with the ranchers that they were committed to protect their property from hunters, from fires, and we help them, give them a veterinary assessment. So we have agreement with the Ministry of Agriculture, and we work for disease surveillance and traceability with those ranchers. We work with the brucellosis and tuberculosis surveillance program. And then we do some research about domestic horses within the Mayan Biosphere Reserve. We find that the horses in one community of the reserve has equine infections anemia. They were seropositive for that disease, and we have to handle how to tell people that their horses are sick and they have to be careful because this is a disease that can affect the wildlife, but we have to take them out of the reserve because it may be a threat for the health. So this is how we have to work in the reserve with the people and their domestic animals that are part of their lives. We have collaborations with other institutions. We know that if we want to work with the One Health approach, we have to do this kind of collaborations because here in Guatemala and generally in Latin America, we don't have the resources, and sometimes we have to work in collaboration with other institutions to look for diseases or the monitoring and surveillance of diseases in our countries. So we have collaboration with university in Mexico, UNAM, and the IRD, is the Institute of Research and Development of France. And this agreement is for, they will construct a lab in Mérida, Yucatan, for students and to look for vector-borne diseases. And we work with them to look for diseases here and work with arboviruses here in the Mayan Biosphere Reserve. And they will accept students from Guatemala and Haiti to work with them in the lab in Mexico. Last year, we worked with the University of Guatemala, and we worked looking for mosquitoes and for arboviruses. We sampled in 3 different places, in the jungle, in communities near to the jungle, and places near to the water and the jungle and the community. We collect a lot of mosquitoes. We are waiting for the results because the mosquitoes were taken to Virginia and they are looking for the arboviruses in the university, and we just want to know if we have some good results. Sometimes when you work with mosquitoes, it's difficult because maybe 1 in 1,000 mosquitoes can have a virus. So if we know that we have a virus, we are this will help us to conduct more investigation in that topic. And for this year, we are going to start a new project that is the implementation of the One Health approach in the Maya forest. That Maya forest is Belize, Mexico, and Guatemala. These are funds that are from GIZ, yes, from Germany. They have 9 projects, 4 in Guatemala, 2 in Belize, and other 3 in Mexico. And all the projects are working with the One Health approach. In our case, as WCS, we are going to work with capacity building, epidemiological monitoring, and the risk reduction and best practices. We are not going to conduct an investigation per se. We are going to work with the government and the communities to look how we can improve the epidemiological monitoring here in Guatemala, and then we can share our experience here in Guatemala to do it in Belize and Mexico too. So our main goal is to strengthen the basis for the risk management, prevention and monitoring of diseases through a regional plan for the implementation of the One Health approach in the Maya forest. So for capacity building, we are going to start with conduct some interviews with key actors in the communities and in the government to look how or what they know about the One Health approach. In the case of the communities, we want to know if they know the relation between their life and how they work with domestic animals and their interaction with wildlife and with the ecosystem, and if they have some knowledge about this, and if they can share their knowledge, their actual knowledge about diseases and how they treat them, to learn from them too. And with the government, we want to look if they know what One Health approach means, and if they know what is the specific function of different every institution who works in the Maya Biosphere Reserve. For example, the Ministry of Health, Public Health, the ISCONAP, that is the institution that works with for the protected areas, and MACAW is the Ministry of Agriculture and cattle. And then with the results of the interviews, we are going to do workshops with the communities and with the key persons in the government to build a strategy with all the components that we can use with a One Health approach. Other activity that we have in this part is that we are going to use the SMART application. It's application that it's used in a lot of countries in the world with protected areas. It's used by rangers. The rangers patrol some protected area, and they put it in this app, like if they see fires or they see something different, or if everything is normal when they are patrolling, they put it in this app. And we have a new add-on that is Smart for Health, that when a ranger looks for or look animal died animal or sick animals, they put it in the app, and if here in Guatemala we are not going to do this, but in Laos, Vietnam, and Cambodia, they are taking samples. Then they translate the samples to the laboratory and communication to the authorities to have a response and look if there is a problem with the health of some animal populations. We are going to work with observations at the beginning and look if it works well. We are going to introduce the sample collection in the next years. We don't use the sample collection now because we don't have the lab capacity to work with the samples here in Guatemala. We have to send it to another country to look for diseases. And for the part of epidemiological monitoring, we want to the goal of this part is at the end of the project we have a national strategy for disease surveillance with One Health approach, where every organization knows their role in the One Health approach and how they work with other institutions, and for example, which diseases we have to look for, which samples have to take, and if the labs if we have that diagnosis in the labs. So the second part of this part of the project is that we are going to buy equipment for the labs here in Guatemala. We are going to buy an ELISA equipment for the regional lab here in Petén, and another PCR for the national lab in Guatemala. So we can have more capacity to work with investigations with wildlife diseases. And another diseases, for example, here in Petén, we work a lot with, as I said, with brucellosis and tuberculosis. And we are going to run a pilot project with monitoring the apparent health status of wildlife through automatic cameras. We saw in the cameras in the camera traps that we have a lot of animals with skin problems like this, and here's another deer with skin problems or some kind of tumors. We can have a diagnostic of that because we are just looking at the photo, but it can help us to look if there are problems in the populations. We can see if there is animals with unusual behavior or animals that are looking sick, and we can look for going to that place and look for if we can take samples of the animals, and this can help to take decisions of something, or look for where is the problem, if there are more contact with domestic animals or with humans, because sometimes we see hunters, or sometimes we see a lot of dogs that are in the same places that are jaguars or pumas, and maybe they can be a relation between this coexistence. And the last part that of this project is risk reduction and best practices. We divided in 3 activities. That one is workshops about combating wildlife trade, and the other part is continued our work with livelihoods, especially with ranchers. We are going to do workshops about sustainability management of the cattle, and in the communities in the reserve, we are going to conduct some workshops about the prevention of diseases in domestic animals, and we want to do if we can take samples from dogs, pigs, and birds to look if they have some diseases that are the part of the surveillance programs here in Guatemala. And also we are going to vaccinate the animals and deworm some animals if the people are okay with that, because sometimes the people don't want us to work with their animals. And finally, we are going to conduct another investigation in collaboration with the Universidad of Costa Rica and Mexico, UNAM, to look for the parvovirus impact assessment in howler monkeys. And this is our like a very brief summary of our activities and the project that we are going to run this year. And if you have questions and if you want to look more of our work, here's our social media: Wildlife Conservation Society in Facebook and Instagram, and WCS Mesoamerica and Western Caribbean are our social media pages. And there is our Gabriela Ponce and my mail if you want to or you have some questions about our work.
Luis, there was a question about where the cattle livestock operation illegal versus legal, and I would like to share a map just to answer that question, if it is okay. Alisa?
Oh, yes, please.
We can the cattle is forbidden in all the nuclear zone, that is national parks and the multiple use zone, and we can work with cattle in the buffer zone, that is these parts.
See, I can show a map that I have here, so it can be clear where the illegal cattle ranching is
you have a map?
Sí.
Okay.
Yes, because this is a very interesting topic, and I need to be clear where we work with cattle ranching and where we don't. Please let me know if you are looking the map. So here is the, see, can you look? Yes. Okay, this is the Maya Biosphere Reserve, and I explained that we have 3 different zones: the buffer zone in the south and the national parks that are the core areas. You can see that here Parque Nacional Sierra de la Candón has illegal cattle ranching in this area where the cows are, and especially in Laguna del Tigre National Park, that it is a core area and is not allowed to have agricultural or cattle ranching. It has a lot of cows there. I was trying to look into the numbers because you were asking about the numbers and densities, and I need to find that to tell you. But the thing is that here in Laguna del Tigre National Park is where the most of the illegal cattle ranching is taking place, and is the area that is being used for other illegal activities that I mentioned. And the modus operandi is to clear the forest in a very remote areas of the reserve, build roads and start establishing illegal ranches and have some livestock there. And in the middle is the establishment of airstrip for the drug trafficking. It is a complex situation, and not only a conservation situation, but a national security situation. And we work where the cattle ranching is legal. In the buffer zone, it is legal to have this activity. And in some areas of the multiple use zone that you can see here in this area that I mentioned that was composed by community forest concessions and industrial forest concessions, there are some cattle for community owners, local people, not big ranchers. In majority is local people, but there are also some illegal big cattle ranches there that are being managed by people that is not legal in that areas. It's a very complex social situation, and the government is taking these cases one by one to solve the situation in the area. We have a good result from 10 years of support in this area that you can see as La Colorada, El Molino. Here in La Colorada, there was a big land cover change in 2009, and the government evicted this illegal rancher from the area, and a restoration activities started there. And now the government has given this area to a community organized group to manage it as a community forest concession. But as I mentioned, it's a complex situation, and it has to be taken case by case to be able to recover these areas. I don't know if this answered the question that you were asking.
Maybe to answer about the numbers of domestic animals, we can know it because it's a changing population of animals always. In the case of the cattle, sometimes it's just for a few time that they have the cattle there, because it's a part that they used to illegal trade to Mexico. So they have it for a couple of months and then translate the cattle to Mexico. And in the case of the other domestic animals, for example, pigs, dogs, we can have a number because they don't prevent diseases. So the animals die and they change a lot the animals, and they have dogs that have a lot of puppies, and then the puppies, the mom of the puppies die, and they have the more dogs, and then they die again, and they buy another dog, and we have like a very complex situation because of that.
Alisa, I was reading a question about if La Colorada that I mentioned is one of the WCS demonstration projects for restoration, and the answer is yes. But mainly the efforts were to maintain the area without forest fires or changes in the forest cover. A special unit of the government, the Park Service and military, was established there to prevent for illegal settlements or forest fires, and then the forest started to recover. We have different approaches for the restoration projects, and we in some areas are working with the communities to eliminate cattle pastures from the areas to promote the forest regeneration, and using some native species trees to start planting these trees, and thinking about the species that can give the communities in the short and middle term some income, such as allspice species, pimienta, that can be harvested in the 5th year of planting, and then other species that can be used in the long term, such as the cedar, mahogany, and that is a different approach. This one in La Colorada is mostly the efforts were for protection of the area.
And for the other question that is in the chat, that for the specific species that can be affected by equine infectious anemia. Tapirs is the most the species that can be the most affected because of that. Tapirs.
I have a question. I first learned about Wildlife Conservation Society's work in Guatemala from a talk about natural security, studying the links between sustainable resources for communities and national security. And I know the Maya Biosphere Reserve has had a lot of success in reducing deforestation and providing those sustainable livelihoods like you spoke about today. But what challenges still remain for you? And overall, how is community acceptance of your work?
Okay, thank you, Catherine. We still have problems with the government's situation that I mentioned to you that doesn't depend on our work as the WCS, but depends on the political situation and collaboration of the national security institutions to return the governance in some areas. In terms of what we are doing in the communities, we make sure that we have the relationship with the communities to implement the projects and the activities that are the ones that they want to implement. We use their needs as communities to implement the activities. For example, the non-timber forest products like chate and pimienta, allspice, and all the products that they are using, we support this work, and by supporting the forest cover maintenance in the areas with the community vigilance and protection committees, and also improving the education opportunities for the community members, and also improving the conditions in the communities where they live, linking other aspects of the conservation, as I mentioned, the reproductive and medical health access in the communities, and improvement of the sustainable livelihoods that they can implement, but always asking first what are the activities and the priorities for those communities. I think that we have established a long-term relationship with most of the communities based on this philosophy of the WCS, of first asking and working with the communities to implement the projects and the activities that they need and they want to implement, and connecting that to the threats that are in the landscape, as I mentioned, the forest fires and deforestation. And because they are managing a unit as a forest concession, community forest concessions, they need to conduct these activities to be fulfilling the contracts that they have with the government. So we work with them to improve the management of these areas, and also improving the benefits that they can have from the management of the forest.
Thank you.
Okay, we are approaching the end of our hour. Does anyone else have a question for our presenters? You should be able to unmute yourselves now if you want to ask it yourself, or if you want to drop it in the chat. Okay, I'm not seeing or hearing any more questions. All right, well, thank you both so much for joining us today. That was so informative and interesting. Would you mind to just in the chat, would you just drop the URL of how people can follow you guys? I know you had it on your last slide, but that's been a minute ago now.
Sure. Thank you, Elisa. Thank you all for your questions, and we hope to keep communicating with all of you. Thank you.
Absolutely. Thank you, guys. And thank you, everyone, for joining us. Have a good day.